They can grow in silence, disrupt your life, and go undiagnosed for years. For millions of women, especially Black women, fibroids aren't just a medical issue. They're a battle with pain, with healthcare, and with being heard. Today on What's Trending, Dr. Mikhail Higgins joins us to expose the truth about fibroids and why the time to talk about them is now. Welcome to the show, Dr. Higgins.
Thank you, Jimena. Pleasure having me. Thank you.
It's great to have you here with us. So, Dr. Higgins, those who may not be familiar, tell us what exactly are fibroids and how common are they?
Yeah, so thank you. So fibroids are benign muscular tumors that occur in and throughout the uterus. And so if you imagine your bicep is a muscle. If you were to take that bicep and put that in the uterus, the womb, it could possibly sprout blood vessels from the uterus. That would be the equivalent of a fibroid.
And how common are they?
So they're particularly common, and as you alluded to, women of African descent, Black women, are the ones that are most predisposed to having them, and typically about 8 to 90% of women of African descent can have them at one point during their reproductive journey.
That's a large number. So why do fibroids seem to be trending in health conversations today? Is it the growing awareness about them?
Yeah, so I think we don't talk about them enough, because I think it's actually a bit of a silent epidemic. You know, when you think about, you know, a group of 10 women, and to think that 8 to 9 of them either have fibroids currently, have had fibroids at one point during their reproductive journey, or will have them in the future, we should probably be talking about a lot more. One of the biggest issues I think about fibroids now is the issues of fertility. What we know is that fibroids can basically complicate pregnancy, cause problems in pregnancy about 40% of the time.
So what causes fibroids? Are there clear risk factors that people should be aware of?
Yeah, so there's sort of the nature versus the nurture. When we think about nature, they grow because of a genetic predisposition. You talked about women of African descent, 80 to 90%, white women about 50 to 60%, Asian women about 23% of the time, and about Latinas about 30 to 40% of the time. So genetics is really the game changer. Either you have the genes or you don't.
And what are some of the most common symptoms of it? Can a person tell in terms of the difference in their cycle, changes from normal to like abnormal?
Right, so great question. So I would say, you know, when you think about that 80 to 90% of women of African descent who have them, I would say probably about 30 to 40% of those women are symptomatic to the degree where they know something is wrong.
And in terms of the current treatment options for fibroids, have they evolved over the years?
Certainly so, and certainly, you know, and this is sort of one of the things that I want to sort of make aware. You know, historically, women have had the option to suffer in silence, okay, or do what? An invasive surgery, okay? And that invasive surgery could be one of two things. Parting with the uterus in the form of a hysterectomy, okay? Their womb, their ability to sort of be fruitful and multiply, which is obviously a deal breaker for someone who wants to have a family, or someone who doesn't want to be out for 10, 12 weeks. Then the other option is a myomectomy. A myomectomy is designed to sort of, you know, it's still a cesarean section scar, which is a very long scar, where they sort of attempt to pluck out each individual fibroid. However, we now know that obviously there's a non-surgical, minimally invasive option, which is the option that I introduced to the Bahamas in 2021, which is called the uterine artery embolization. This is a procedure that's been sort of around since 1995 in France, and in the US since 1996. So this is a procedure where I don't sort of basically trim fibroids or find the ones. I basically attack the entire blood supply to neutralize the entire blood supply of the entire network. It's almost, if you imagine Christmas lights are on a Christmas tree and you unplug all of the lights at the same time. They all go out, whether they're big lights or small lights. And so that's what we do in terms of the embolization.
So if there is one thing that you want our audience to take away from this conversation, what would it be? It would be
is that you have an option to receive a non-surgical, minimally invasive treatment that will leave you literally without a scar. The incision is about the size of a grain of rice in your groin. You'll be back to work within 7 to 10 days typically, and it's a procedure that treats all of your fibroids. There's little to no recurrence unless you sort of have 15 years where you're looking at recurrence. So 8 to 15 years would be sort of the typical recurrence rate, and most of the women that present to me are usually 35 and older, in which case the recurrence rate is close to 0.
Oh, definitely great information there. So fibroids are common, but silent suffering doesn't have to be. Thank you so much, Dr. Higgins, for shedding light and giving voice to so many women.